Welcome to Exam Tips with Dr. Lorinda Lohner. Lorinda is an award-winning educator and best-selling author with over 17 years of experience teaching pharmacy and nursing students across the globe. She was named Master Teacher by one of the largest medical publishers in the country for her innovative approach to education, including the development of a PTCE exam prep mobile app and review program that led to record pass rates. Her book, Top 200 Drugs Memorizing Made Ridiculously Easy, has been an Amazon #1 bestseller in 4 categories for over a year now. As a passionate advocate for creativity in science and healthcare, she empowers students to think beyond the textbook and connect learning with purpose. Outside the classroom, she's also a TEDx speaker and a devoted mom, championing the idea that you can be both brilliant and imaginative. Please welcome Dr. Lorinda Lohner.
Hi, welcome everyone to the Pharmacy Technician Student Summit 2026. You might be wondering who I am and how can I make this claims? Why am I standing here in front of you to talk about exam tips, the 100% pass rate blueprint for the PTCE and EXCPT? My name is Lorinda Lohner. I've been a pharmacist for 28 years, and I've been in classrooms teaching pharmacy technician students for 18 years. Fun fact, I did take both the PTCE and the EXCPT, and to this day still holds a 100% pass rate on both the PTCE and EXCPT. Today, you're going to learn about not the anxiety of how much to study, but we're going to focus more on how to think to pass the board exam. So let's start. Why do smart students fail the PTCE or the EXCPT? For purposes of shortening it, you'll hear me talk about it or refer to it as board exam. The real reason smart students fail the PTCE or the EXCPT or the board exam is because of the vocabulary test mindset. Students usually approach the exam as a test of raw, rote memory. They attempt to memorize everything, all the top 200 drugs, the thousands of isolated drug names, brands, generic, even formulas and legal laws, regulations without connective context. What happens is this results in overwhelm, burnout, and failing scores on complex scenario questions. So, how do we pass? How do smart students pass the PTCE or the EXCPT? Okay. Exam writers construct questions to test real-world clinical safety or application and logical deduction. So the exam evaluates not only how much you retain or how much you can recall. The exam evaluates how safely you apply the knowledge, not just how much you've memorized, how much you can recall, as I've mentioned. This results in passing the PTCE or the EXCPT. Instead of memorizing, instead of running on lists, we understand systems, we understand processes, and that's the safety and logic mindset. Now, I did create what I call a certification trifecta. So it contains content mastery, preparation time, and exam logic. Let's talk about content mastery first. Okay. Every student preparing for the board exam will have a blueprint for the exam, the PTCE or the EXCPT. They'll have the weights, the topics that you'll be tested on, pharmacology, math, law, compounding. Yes, this is an important part of the test because this is what you're going to be tested on. The common mistake, students focus too much on that. As I've mentioned, this is a trifecta for a 100% pass rate zone. Preparation time, the second ingredient, is just as important as the content mastery. Why is that as important? Because if you're prepared, the more prepared you are, the less anxiety you have during a test. Too much preparation leads to test anxiety. Too little of preparation leads to test anxiety. So, being prepared just the right amount eliminates, maybe not totally eliminate, but lessens that test anxiety. It builds confidence because you know that you've studied every single content: pharmacology, math, law, compounding, inventory. You're prepared, you're confident. So, content mastery plus preparation time are two of the major ingredients. But it's not yet the exact formula for the 100% pass rate zone. We have the third ingredient, which is the secret sauce, which is exam logic. Exam logic is just as important as your content mastery and your preparation time. Why is it important? In test taking, we cannot totally eliminate test anxiety. There'll be a little bit, even if you're prepared, even if you're confident, even if you had enough time, even if you studied every single thing or every single book. Sometimes it's not, I mean, I wouldn't advise you to do that because that's where overwhelm and test anxiety happens. But going back to exam logic, this is an important sauce, as I've mentioned, because this is when and how you think during a test. People who know me or students who know me know that I'm big on making educated guesses. So, educated guess is part of this exam logic. We all know that the PTCE or the EXCPT is a multiple choice question or a set of multiple choice questions with four options. And there'll be distractors. There will be distractors. And sometimes you'll think, two of these four options are correct. But are they really correct? Or two of the four options are true or are facts? And this is why the instructions on tests say choose the best answer or choose the correct answer. So it doesn't mean that two of the options are true or are facts, that they're both correct answer. The answer should be what answers the question. So there'll be distractors. And we should be able to identify which ones are distractors. So to recap, we have the certification trifecta, which creates the 100% pass rate zone. You have to know the content. Pharmacology, which pertains to your patient safety and medications portion of the PTCE. Math or pharmacy math, pharmacy calculation, which also pertains to patient safety. Law and regulations, which is another category or knowledge domain in the PTCE. Compounding, which falls under regulations and patient safety. Preparation time, not too much. Do not think that I need to prepare for a year. I need to prepare for 30 days. I need to prepare for 90 days. I do like preparing just the right amount of time, but what's the right amount of time? I'll talk about the right amount of time in my next slide after this one. But let's talk about mistakes first that students do or test takers do, or two critical mistakes sabotaging your exam score. There are two big traps. The first one is the pharmacology trap. I'll talk about the wrong approach first and what's the pass rate approach. The wrong approach is randomly memorizing individual drugs alphabetically. Most of the lists that we can find online of the top 200 drugs will be in alphabetical order. This is the reason why I wrote a book, Top 200 Drugs Memorizing Made Ridiculously Easy. And I grouped those top 200 drugs by class. Grouping them by class helps us systematize and helps us remember that this drug pertains to this indication. Let me give you an example. Say, for example, you are trying to remember cholesterol medications. And many cholesterol medications will have the suffix statin, simvastatin, atorvastatin. Okay. Once you hear the statin in the generic name, you know what class they fall under. HMG coenzyme A reductase inhibitor or anti-hyperlipidemic. And if you hear that, you hear the root word, then you know the class. And if you know the class, then you know what the drug is used for. You don't have to memorize 8 different cholesterol medications. By just remembering that statin, which is a suffix, or any other root pertains to cholesterol medication, you probably memorized about 12 drugs already of the top 200 drugs. So grouping them by their stems, by their roots, by their suffixes, or by their prefixes gives you a system, gives you something to remember or to anchor on, that this particular stem pertains to this particular group, and this particular group does this. And and this one is a drug for this one. So it all is tied together. Another example, sown. Okay. What is sown? Sones are corticosteroids. What are corticosteroids? Corticosteroids are anti-inflammatory. So once you hear a specific root, prefix, or suffix, you associate it to a class. And then once you know the class, then you can actually figure out what it's used for. And then you actually remember a group of drugs, not one, not two, 10 at a time, 15 at a time. So you really don't have to memorize these drugs in order alphabetically. That's the worst way and the wrong way to remember this. Have a system, group them. Second mistake, the calculation trap. I focused on this too because most of the time in my 18 years, over 17,000 students now, the two major classes or courses that they're worried about are pharmacology and calculations or pharmacy math. And so this is where the biggest mistakes happen or the biggest traps are. So let's proceed with a calculation trap. Wrong approach. Math panic. Why do students panic or test takers panic when it's math? One, it is a challenge for many students. Um, Math is a challenge for many students, and that's a given. But to panic adds to that challenge. And let me go back to my previous slide, which is the trifecta preparation time. If you prepared enough using the content and going over all the content, you should lessen that anxiety. You should lessen the panic mode. And so people panic, test takers panic when they see a lot of numbers. Looking at complex multi-step calculation, word problems. That's what students always say. Oh, if it's a word problem, I don't like it. They just want straight up calculations and conversions. Unfortunately, The tests, PTCE or EXCPT, will be in word problems if they come up as a math question, but they usually come up as word problems, not specifically math. The pharmacy calculations may be hidden under a case. It can have four different numbers, but you'll only need two, or you only need one and know the conversion of that. So go back again to the previous slide. We have to be able to know how to eliminate the distractors. How do we do that? Well, read a problem. Not once. I do recommend to read it a minimum of 3 times. I know the test is under time, on a time limit. However, reading it 3 times doesn't really eat up your time. You'll have about 1 minute for every question and you'll still have left over. So if you didn't understand a problem the first time, read it again and again. I would write the numbers. And since the exam is computerized, if it's paper, we can highlight, we can encircle. Since the exam is computerized, you are given, by the way, three, back in the day it was three. I don't know if this increases back to back, sheets and a dry erase marker. And you can use that to put the numbers in. Put the numbers, you may put all of them first and then cross out the ones you don't need, the distractors that I've been talking about. Cross those out. Cross out the distractors and go back again to the problem and read the question. What are you being asked of? Are you being asked of just the temperature? Are you just being asked of the body surface area? Are you just being asked of amount per dose or amount per day or total quantity to be dispensed? These are all important because this is how you're going to get it wrong if you don't pay attention to the question. And this is a common problem or mistakes that students have. Their final answer would be they did a calculation right, but they're choosing an answer that's for a total quantity to be dispensed. And the question was, how much per dose should we give the patient? So right off the bat, you'll get the answer wrong. And most of these options will have the per dose, per day, and total quantity as your distractors because it's testing whether you can understand or whether you comprehend the problem. I know it is a test um, of what you've studied, of the content, but it's also a test of comprehension. So read a problem again. What I tell you to not do is to never, ever do mental math, no matter how good you are in math. It doesn't matter how good you are in math. Write it down. Write it down. Don't do mental math. The stakes are so high for you to be doing mental math. You can do mental math if you want to do that, but double check your work by writing your answers and doing it step by step. If it's multiple steps to a problem, put step one, step two, step three, and then go back again to the question before you choose your final answer in the multiple choice question. Just in my example, was the question per dose? Was the question per day? Or was it a question total quantity? Three different questions, three different answers. So those are the two biggest traps or mistakes. How test takers, even if they've prepared or are confident, sabotage their exam score because they didn't pay attention to the question. And if I'm to take the PTCE or the EXCPT again, I'd like to have an execution playbook. The disclaimer on the slide first. I know you see that this is a 30-day execution playbook. However, there's a phase zero to this. I personally do not recommend that you do a 30-day prep before a major exam like the board exam, PTCE, or EXCPT. I think the sweet spot is about 90 days, 6 months to 90 days. So 3 months to 6 months. Okay. So what's the phase zero? Phase zero is going to be your preparation time, be it 3 months or 6 months. I highly recommend that you take a PTCB recognized training or education program like Cengage's or Ed2Go's. I'm not saying this because I'm the curriculum manager for Ed2Go's pharmacy technician program, but I'm saying that Ed2Go's pharmacy technician education program is one of the best preps, not only because it's PTCB recognized, but because it includes the fee or a voucher for you to take the PTCE or the EXCPT. So your tuition includes a voucher to taking the test. So that's taken care of. That's one thing that you don't have to worry about. So going back, enroll in an accredited or a recognized PTCB recognized program. And then that's your phase zero. Phase one would be days 1 to 14. Days 1 to 14, 2 weeks. What are you going to do on phase one? Master your high yield pharmacology. Why are you going to spend 2 weeks on this? 30 days out, 30 days before your exam day. Because pharmacology or your top 200 drugs fall under medications and patient safety, which are the two highest weighted content in the PTCE. About 60% of the test is drugs, medication, patient safety, application. So drill the top 200 drugs. I don't like the word memorize. So remember this stems, this roots. Prazole. What does prazole as a suffix pertain to? Sown. Oh, lol. Remember this. Other, because if you know this, again, if you know the suffix, the roots, and the prefix, you know the class, you know what it's used for. Drill this. Remember, if you're to memorize something, I don't want you memorizing the drugs. Memorize the stems, the roots, and the suffix. Review common contraindication. This falls under your patient safety knowledge domain. Drug to drug, drug to food, drug to disease interactions, drugs that specific groups should not take, children, people with liver damage, kidney problems, geriatrics, so all this special population. If a drug has a black box warning, remember this, refrigerated drugs. Phase two, this is your days 15 to 21. Drill the math, drill the law. So here's your 30-day execution playbook. I'd like to give you a disclaimer on this one first. I am not recommending in any way that you only study for 30 days or prep for 30 days. Um, there's a phase zero to this, which is your prep time, as I've said. Do I think that 30 days is enough prep time to take the PTCE? I would say no. I think the sweet spot would be 3 months to 6 months. So let me talk about phase zero. Phase zero is your prep time. That's when you study all of the contents. And this playbook is a 30-day leading into your exam date. During phase zero, during your prep time, I highly recommend that you enroll in a PTCB recognized program, such as Ed2Go's pharmacy technician program. I like Ed2Go's pharmacy technician program, not only because I'm the curriculum manager for that program, but because the exam fee is included in the tuition fee. So that's one thing you need to worry about. You don't need to worry about. So you don't have to worry about paying for your test. It's your choice whether you take the PTCE or the EXCPT. So phase zero is studying, formal studying or reviewing on your own 3 to 6 months, especially if you don't have a background in medicine, in pharmacy, in the medical field. This playbook is 30 days leading into your exam day. After phase 0, which is your prep time, content mastery time, we do phase 1, days 1 to 14, 2 weeks. Master the high yield pharmacology. Why 2 weeks? Why pharmacology? Because pharmacology falls under the medication portion or the medication knowledge domain of the PTCE blueprint and falls under this patient safety knowledge domain of the PTCE. Those two alone are over 60% of your final score. So we spend more time on this. What do you study? What do you need to do? Days 1 to 14. Drill the top 200 drugs. Don't memorize it. Again, don't memorize it alphabetically. Group them by class. Group them by system. If you're to memorize something, memorize the prefixes, roots, and suffixes, such as your olol, your son, your prazole, your statins, your prils. Memorize those, because if you know those stems, those roots, those prefix, those suffix, you know what the class is. And when you know the class, you know what they're used for. Okay? And so you can remember a group of drugs in just a few minutes, 10, 15 in one class. Review the common contraindications of these drugs too. Focus on the drugs that have drug to drug, drug to food, drug to disease interactions. This fall under patient safety. Focus on drugs that needs special attention when prescribing or when taking, especially to special population or groups such as pediatrics, pregnant women, geriatrics. So focus on those. A lot of the questions will show up pertaining not only to drugs, but patient safety. And the patient safety part of the board exam, I don't want you to think of it as I want to pass it. This patient safety part is something that you will have to be mindful of and do once you're practicing as a pharmacy technician. Phase 2, days 15 to 21, 1 week. Drill the math, drill the law, okay? Most of the time, students memorize the formulas. And most of the time, students panic, okay? If you do a lot of practice, worksheets, the formulas come in naturally. You don't really have to memorize them. So, what do I suggest? Do a lot of worksheets. A lot of things. I remember my pharmacy calculations professor back in pharmacy school said, there's not a single problem in pharmacy that you cannot solve using ratio and proportion. So when I teach pharmacy calculations, I always solve a lot of the problems using ratio and proportion or dimensional analysis. But through the years, 18 years, students are more comfortable doing ratio and proportion. There's no shame in doing the simple ratio and proportion. Okay, so do a lot of worksheets, practice worksheets, review the laws, the most important laws that are pivotal in the practice of pharmacy from 1906 to the Poison Prevention and Control Act to the Durham-Humphrey, the Kefauver-Harris, all of those show up on the PTCE. The Combat Math Act, those show up. So drill on those. What each laws contain, not necessarily the year, but the title of the law and what it has, what it contains. Incorporate sterile and non-sterile compounding because there are questions on sterile and non-sterile compounding, USB 797 and USB 795. Not only the math portion, but also the processes. So incorporate that in that 1 week. Remember, this is 30 days. It's a 30-day playbook. It's not your phase 0. So this is a review. And if you've forgotten to incorporate sterile and non-sterile compounding, now's the time to do that. Pharmacy SIG codes, do that on this phase as well. BID, bis in die in Latin. If you want to remember it, B stands for bi. And how many wheels does a bicycle have? Bi, 2. And then TID, trae in die in Latin. If you're a Spanish speaker, tres. How many wheels does a tricycle have? 3. So now you know it's TID. PO, per orem. In Spanish, por oral, by mouth. When I say words in Latin and then I say some Spanish words, it helps. Remember, funny sticks in the head. So use language, scenarios, stories for it to be funny. So it sticks in your head. I would say funny sticks in the head. And phase 3, your day 22 till 30th or days 22 till the 30th, build stamina with time tests. I want you to complete full length timed practice exam in a single sitting. 90 questions to simulate the test. And I want you to simulate this in an exact testing environment conditions. No distractions. Set a timer, 2 hours. Take the test without pause so that you can simulate the environment, the testing environment. Take as many practice tests as you can. And of course, you'll get the results to that. Analyze every incorrect answer to understand the secret sauce, which is the exam logic in the trifecta. And once you see your scores, you will see, okay, I keep committing a mistake on the law part. So I need to brush up more on law. You know specifically what handout, what book, what topics to brush up on or review. So again, this is your 30-day execution playbook leading into your exam day. Oops. And lastly, I'd like you to know that your exam score proves you can take a test. Your career proves you can save lives. Let's get the test out of the way. You have the blueprint, you have the playbook, you have the 100% pass rate method. Execute with confidence. I believe in you. You got this. Thank you.